Hi, I'm Manpreet Kaur. Today I'm presenting telemental health during COVID-19. Telemental health is the use of telecommunication or video conferencing technology to provide mental health services. It is sometimes referred to as telepsychiatry or telepsychology. Research suggests that telemental health services can be effective for many people, including but not limited to those with post traumatic stress disorder, depression, and anxiety. As we all know that the COVID-19 has infected millions of people and altered the life of every human being on the planet. Widespread restrictions of movement, social distancing, physical isolation, or called lockdowns, were implemented from March 2020. The sudden loss of employment and social interaction have impacted the mental health of most of Australians. In 2020, World Health Organization predicted that COVID-19 has the potential to contribute to or exacerbate long-term mental illness including anxiety, depression, PTSD, and substance misuse. The early report from the Lancet's COVID-19 Commission Mental Health Task Force suggested that during the COVID-19 people will move from right to left to mental health continuum, as you can see in the mental health continuum figure. What was the ground reality during COVID-19? In 2020, which was March and April, community studies of Australians revealed elevated depression and anxiety symptoms resulting from pandemic-induced financial stress, loneliness, and disruption in the domain of work, leisure, and relationships. The University of Melbourne's Melbourne Institute conducted a national survey from April 2020 to December 2020 called Take the Pulse. According to the survey, in early 2020, 20% of Australians reported feeling depressed and anxious most or all the time. Employed parents aged 5 to 11 years old kids reported higher level of mental distress, nearly 4 times from 7% in April to 27% in June. In December, Melbourne Institute released the report Coping with COVID-19, Rethink Australia. The report found out that rates of mental distress had a similar pattern to financial stress over the course of pandemic. The rate of mental distress in November 24% was higher than April 20, which was 22%. According to Australian Bureau of Statistics, women were experiencing high level of depression, anxiety, stress as compared to men during this COVID-19 period. How the mental health services were implemented during COVID-19. It's very interesting to know that prior to COVID-19 measure, psychological sessions by telehealth were only available by video conferencing for patients from rural, remote, and very remote regions in Australia. During the COVID-19 pandemic, Australian government introduced a wide range of additions to Medicare benefit schedule (MBS) to support provision of healthcare via telehealth. These services included the telemental health services provided by GPs, psychiatrists, psychologists, and other aligned mental health workers. Mental health service called better access to psychiatry, psychology, and general practitioners are available for eligible person through telehealth or face-to-face. Prior to pandemic, the uptake of telehealth in Australia was described as slow and fragmented. The response to subsidized telemental health was positive and upward. As you can see in this graph, the telemental health service peaked at the end of April 2020 when half of the mental health services were provided by telemental health, which was 49.9%. And you can see that how face-to-face and telehealth lines are merging at the end of April. So what were the implications of telemental health? Well, there is not much research available on implications of telemental health because it's relatively a new research topic. But as I was able to find few studies. Telemental health provided during COVID-19 to children, young people and adults, which was internet-based CBT, cognitive behavioral therapy, demonstrated that interventions are feasible, acceptable, and as effective as in-person services. For example, a recent meta-analysis of Synchronous telehealth treatments reported on its effectiveness for adults with common mental health disorders, for example, depression, anxiety, and adjustment disorder. Now, what about PTSD? Early research from countries first affected by COVID-19 pandemic have shown the PTSD symptoms among individuals most affected by COVID-19 related traumatic events. For example, exposure to patient or colleague's death, involuntary quarantine, working in settings with high risk of virus exposure, and having to make tough decisions about the allocation of medical intervention, etc. Cognitive processing therapy significantly reduced PTSD symptoms when delivered through telehealth during COVID-19 and CPT. And CPT was non-inferior to in-person therapy. The results indicated that participants had large reduction in self-reported PTSD. But what about the population with serious mental health illness? This mental health illness include psychotic disorder, bipolar disorder, major depressive disorder, and schizophrenia. SMI population. Before COVID-19, SMI population were among the most challenging to engage in traditional in-person therapy. COVID-19 pandemic was thought to impose more treatment barriers for SMA patient than general population due to disruption in care delivery and symptom exacerbation. Further, COVID-19 required a rapid transition to teletherapy for SMA patient due to its contagion. With the stay-at-home order, SMA patient had no choice but to adopt teletherapy in order to continue care. This study, conducted by ASMU et al. 2020, found out that the rate at which SMA patient converted from in-person therapy to teletherapy, which was 52%, was not statistically different from that of the non-SMA group, which was 48%. SMA group had significantly more teletherapy sessions attendance than the non-SMA group. This suggests that SMA patients stayed engaged in telehealth after conversion. Overall, this finding shows feasibility in telehealth conversion and engagement among SMA during the COVID-19 period. Results from this study showed that telehealth can be widely implemented to meet the psychological needs of SMA and general population during a disaster or epidemic. Overall summary. The outbreak of COVID-19 pandemic has resulted in major transformation the way mental health interventions are delivered in Australia. Mental health clinicians and services had to rapidly transition to largely telehealth delivery or ensure continuity of care to patients and families. Australian government extended telehealth services, telephone or online, through Medicare for the next 4 years. This extension includes telehealth psychology sessions too. These changes have the potential to extend the reach and accessibility of mental health care to all Australians. Telehealth has been described as the next big frontier in the efficiency and effective delivery of healthcare. Thank you for listening.